So we did present some information on the early phase 1 results for the next generation drug of voxelotor. Right now, we call it GBT021601. We conducted a phase 1 in healthy volunteers and in patients. To just give kind of bigger context, we know that sickle cell disease is an inherited disorder of the red blood cell that is best characterized polymerization of deoxygenated sickle hemoglobin. This leads to the chronic anemia and the vaso-occlusion, and is this a recurrent accumulative injury and inflammation that can start early in childhood that leads to progressive end organ damage and substantial morbidity and early death. So voxelotor is the first-in-class drug that actually directly inhibits that hemoglobin S polymerization. And what we have now is the next generation drug that we're starting to test in the phase 1 to see if it actually can do a better job and has a better safety profile. We have 6 patients that have completed the first single dose and then 2 MAD doses. In general, all patients tolerated the medicine well. The safety profile was very similar to what we are experienced with the voxelotor. However, we did achieve hemoglobin occupancies with the drug that blocked the polymerization to a larger extent. And so these patients actually had, on average, an increase in their hemoglobin from baseline of 2.3 grams per deciliter. This should allow them to have less clinical symptoms and reduce the risk of some of this long-term organ damage that occurs in sickle cell disease. So in comparison, the average hemoglobin increase for voxelotor was 1.1 gram per deciliter. This was significantly higher. Most patients achieved that, and also some patients even got up to a hemoglobin of 2.7 or